Yesterday, Health Minister Dr Aaron Motsoaledi launched South Africa's new HIV treatment campaign, which aims to put an additional 1.1 million people on treatment by the end of this year. This forms part of the country's ongoing interventions to ensure 95% of people diagnosed with HIV receive and adhere to antiretroviral therapy. South Africa has around 7.8 million people living with HIV and AIDS, with 5.9 million of them on ARV treatment. For reaction now on this new campaign, let's hear from UNAIDS, which together with the South African government have set a target of 2030 to end the AIDS epidemic. Let's now speak to Country Director Eva Kiwango, who joins us live now. Eva, good evening to you and thank you so much for your time. This Close the Gap campaign, of course, it's launched with, quite some serious ambitions there by government. The minister speaking about how they really want to work hard to get additional people on to the treatment. How far does this go towards that target of ending AIDS as a public health threat by 2030? Eva, you are on mute. Pardon me. We still have that hangover. We still have that hangover of COVID-19. You can go ahead.
Thank you, Bongiwe, and good evening to you and your viewers, and thank you for this opportunity to talk about this massive campaign that South Africa launched yesterday to look for an additional 1.1 million people who are not on treatment. The United Nations Joint Programme on HIV and AIDS welcomes and supports the launch of this campaign, especially right now, when the global health community is experiencing such seismic shifts. AIDS in South Africa seemed an insurmountable crisis. But today, as President Ramaphosa highlighted in the State of the Nation address, 96% of people living with HIV in South Africa know their status, 79% of them are on treatment, and 94% of those on treatment are virally suppressed. But still, if we want to end the AIDS pandemic in South Africa, we must bring those numbers to 95. And this is a target that we set for 2025. The campaign is more significant now, given the disruptions in services caused by the US pause in PEPFAR, with South Africa, but with South Africa's ongoing leadership and commitment to ensure all HIV services continue. This campaign is more important than ever. It is also significant because it is multi-sectoral in nature, involving all partners, including the South African National AIDS Council, government, civil society, and the private sector. And this is really important because when communities themselves lead, we see greater results. Lastly, the campaign is based on evidence, and it has very clear targets for each province, down to the district and health facility, and it has identified the priority populations we need to find as the men, children, and young people. And one of the sentiments that stood out to me yesterday during the launch is that men don't come to clinics, and that means they're not accessing services. And as UNAIDS, we welcomed the launch of the SANAC Men's Sector Men's Health Campaign, known as Better Men for Tomorrow, calling on all men to seek health services and learn about their HIV status and general well-being.
And Eva, at some point, we were talking about adolescents being an area of concern and trying to get them to really use these facilities more. But as you say, we're learning about men. And I wonder how then, do those who are working in communities, because they're also critical in this conversation, begin to change that mindset to say that they also need to be part of those who are seeking healthcare treatments?
So the way we should approach this is really getting the men themselves to lead and to bring other men into the clinics. There's evidence that this works when we have peers leading or working with their peers. So the men know why their fellow men are not coming into the clinics. And as I said, the campaign that was launched, the Better Man for Tomorrow, also, will utilize this approach, finding the men where they are, whether it's on the farms, in the mines, in workplaces, in taverns, and really encouraging them and bringing them in for services. But it's also important that we make sure that these services that men need are accessible. Long waiting hours in health facilities really discourages men from coming in. So we need mobile clinics where they are working, making sure that they're being serviced by healthcare providers who can talk to them, who can understand their needs, and making sure that we are doing a wraparound campaign and making sure it's not just about treatment, but also making sure that it's about prevention and making sure that we are scaling up prevention services, including proven tools like condoms and introducing things like PrEP, which is pre-exposure prophylaxis.
Yeah, and when you also, not only looking at men, there's also another group, the adolescents that I've just spoken about as well, to ensure that when they do access some of these healthcare services, they also met with friendly faces and faces that are also willing to talk to them and take them through some of what they need to know preventative-wise, but also even post-exposure.
Absolutely. And once again, SANAC, working with young people, has developed a HIV prevention campaign for young people called Zikala Kanjani. And in there, they have really unpacked and specified what is needed. Efforts are underway to make sure that the Department of Health establishes youth-friendly health zones in health facilities, and these are now available in many of the health facilities. They're working with healthcare workers to make sure that they understand the needs of young people, making sure young people are around the table themselves to address their needs, to tell us how this should be done. Nothing for them without them, as they always say to us. But I'm also wanting to point out here that the disruptions caused by the pause in US funding has impacted on prevention services for, adolescents, as well as key populations like men who have sex with men, people who inject drugs, sex workers, and transgender.
And that's where I wanted to go, because, you spoke earlier on about the seismic shift and the concern at grassroots level, even with, some of the NPOs, the health workers on the ground, the community workers themselves and communities themselves. Let's talk about the impact that this could have, especially when it continues, because now you do have people who say, yes, the aid may come back, but it may not come back in the manner in which you've seen before.
Yes, Bongiwe, and I really hope that upon the review's conclusion, we have a 90-day period within which the US government is reviewing all foreign aid assistance, and we're hoping that PEPFAR will remain fully operational and can continue our important work on long-term sustainability of the HIV response. So this is definitely a wake-up call for all of us. PEPFAR has been one of the most important and impactful health programs in history. We are all deeply concerned about its future, like I said, and the potential erosion of the important gains that we have made. I really thank the South African leadership for understanding the life-saving HIV programming can and must continue even during this pause. UNAIDS is a joint program. We convene 11 UN agencies. So we're working, UNAIDS is working together with WHO and UNICEF and UN Women and others to make, with our partners in government and civil society and in the private sector, we're calling on the private sector to really stand up and help us fill the gap and to understand the impact of the pause, the 90-day pause of all foreign assistance. So what are we doing? We are working with partners to determine whether the waivers that were issued after the stop work orders have allowed some of the US-funded essential staff to resume work. We are working to determine the extent of the disruptions, especially to HIV prevention, as I said, and to source solutions. And we are also supporting assessments to understand exactly which populations have been affected by this pause. We know some drop-in centers, especially those that have been funded by USAID, remain closed. But we are also fully supportive of the government's contingency plan. I know the Department of Health has developed a contingency plan that provinces are now implementing, and I know other departments, including Department of Basic Education, have also developed a plan, a contingency plan. So we fully support these plans. We're very supportive of measures to make sure that drugs are dispensed on a multi-month basis so patients don't keep coming into the clinics so as to relieve the workload. And we are also analyzing the funding and historical spending data from the recent years to understand what exactly PEPFAR has been funding. We're collaborating with SANAC to make sure we develop a sustainability roadmap, because like I said, this is a wake-up call, and we really need to be thinking about long-term sustainability of the HIV response.
A wake-up call indeed. And I wonder, Eva, when you look at South Africa's story, there's a lot to say, especially about the ARV treatment and how more people now are able to access this and do have the dignity and do have, the opportunity to live healthier lives. What would have been the risks if the government did not ramp up efforts here to ensure that this is done?
Well, I mean, I think we are all aware of the added value of this amazing treatment program in South Africa, which is the largest in the world. And I just want to reiterate and to acknowledge the efforts that went into, making this treatment program a reality, including the efforts of civil society, which at the forefront of fighting for treatment to be made accessible and reachable and affordable to middle income and low income countries. So the treatment program in South Africa, we are at a point where we have achieved our first 95. We need to work to put 1.1 million people on treatment, as we discussed earlier. But we also need to make sure that, on top of the fact that South Africa is already funding 74% of the response, that we continue to make sure that we cover the 17% that's funded by PEPFAR. We need to become self-sufficient. It is an issue of sovereignty. It is an issue of making sure that these political shifts, these shifts that happen at a global level, do not affect the health security of countries. We have to also make sure that while we sustain the antiretroviral treatment program and we make sure that we put an additional 1.1 million people on treatment, that we're doing much more to lower the number of new infections that are happening every year. 150,000 new infections. And these are occurring disproportionately among young women and adolescent girls. So we need to do more to reach young people, to make sure young people's knowledge and awareness of HIV is increased, that their access and use of prevention technologies, including things like condoms, is scaled up. We need to make sure that we are introducing new technologies like the long-acting lenacapavir, which is a long-acting prevention technology that is 100% effective. It's a twice-yearly injectable that removes the risk of acquiring HIV at 100%. So we need to prepare for the rollout of lenacapavir. We had plans in place before the pause, and we need to make sure that we continue with those plans so we close the tap of new infections.
Yeah, new infections, quite a huge concern. Eva, appreciate your time this evening. Thank you so much for chatting to us. That is Eva Kiwango, the UNAIDS South Africa Country Director.